Hey guys, let's attack this question together. Right away, without even reading the scenario, you can see a huge list of answer choices that can be um, difficult to accept and possibly distracting, maybe making you feel a little scared, but it's okay, or intimidated, but it's okay. All right, let's do it together. Let's attack the scenario. Okay, read the last three lines like I always ask you to do. He does not smoke or use illicit drugs. Okay. 100%, 100 degrees Fahrenheit, temperature a little high, mildly pale conjunctivae and annular erythematous lesions with a dusky central area on the extensor surfaces of the lower extremities. Right away, when I think of mildly pale conjunctivae, I think of anemia. Yes, which of the following is the most likely causal organism? All right, let's go to the top a second, because as I always mention to you all, read the last three lines always. Then, if you have enough knowledge, enough pertinent findings that you've read and you've observed and absorbed, hit the answer and move. But typically, it might not be enough for you. So go to the top just to double check or try to extract more information. A 23-year-old male comes to you because of a 2-week history of fatigue, muscle aches, dry cough. Okay, dry cough. He has also episodes of painful bluish discoloration of tips of fingers, nose, earlobes during this period. Stop. Now, anemia and bluish discoloration, this is Raynaud's phenomenon. So there's an organism that causes pneumonia that's going to cause anemia, Raynaud's phenomenon. Think about that, right? Also, 3 months ago, he joined the military, attended basic training, Southern California. Be careful. When you see Southern California, you can automatically think coccidioides imitans. Take this out right away because this is located in California and Arizona. Remember, when there's earthquakes, the spores are released from the ground and people ingest and they get admitted to the hospital and they have coccidioides. Be careful though, it doesn't cause anemia and it doesn't cause bluish discoloration. This is where it's difficult and it's challenging because most of these answers, if not all of them, cause some sort of dry cough or wet cough because it says dry cough, muscle aches, California. But the main thing to focus on is anemia and the tips, which are Raynaud's phenomenon. You go through top to bottom. Pneumonia here, strep pneumo, that causes wet cough. Chlamydophila pneumoniae, Mycoplasma pneumonia, Legionella, these are atypical pneumonias. Yes. Blasto out. Regions different than Southern California. Adenovirus, good answer. It is found in military barracks, but it does not cause Raynaud's phenomenon, does not cause anemia. So that's also out. That's where I need you to work on power of elimination. All these answers fit somewhat of the criteria, but there's only one here. One here. RSV? No. EBV mono? No. Influenza? Now you're left with chlamydia, mycoplasma, legionella. Legionella is usually, they present it with um, severe diarrhea. The diarrhea causes severe electrolytes. That causes confusion. So be careful because when you have somebody who's confused, you might think it's a neurological problem. In reality, they might have severe diarrhea, which causes them to lose those electrolytes. But Legionella is a typical pneumonia and is usually presented like in work conferences, air system, mist machines, and everything. They put this purposely here, but this does not cause anemia and Raynaud's phenomenon. Anemia and Raynaud's are the two things, are deciding factors to choose the answer. You're down to two answers. Mycoplasma is the only organism here that has cold agglutination, which then causes, if people who have the illness, to have anemia and Raynaud phenomenon. Because of this, you'll be able to get the answer. This question is a very, very good question. It allows you and all of us here to read every answer choice thereafter and make sure why these are wrong and allow us an opportunity to review. Look at this, 38% chose this one. I know why, because it said Southern California. This is endemic to California, yes. And it can cause atypical pneumonia, which is what? Dry cough, fever, fatigue, myalgia, and erythema multiforme. However, this person has mild pale conjunctivae and bluish finger discoloration, which are both indicative of Raynaud's phenomenon anemia. Coccidioides does not have either of those, okay? And that's why you have to be very, very careful and cautious. So the answer is Mycoplasma pneumoniae. Learn it completely, read it, review it, head to toe, and I promise you, you'll definitely get a question like this on the exam. All right, guys, I'll see you on the next question.